What we're going to do now is get started in, I'm going to show you a patient demo right off the hop. And a lot of times people say, well, why are we doing the patient demo right off the hop? Because I'm going to show you the final product. Because this is what we're going to aspire to. I have a patient, never met her before. I'm going to go through my scan, do a guided history, treat it using the acupuncture, and then reassess. And then from there, we'll get into doing what we do. I'm going to start, just hold that up. I'm going to start doing some muscle testing. I push down, you push up.
Okay.
Push up, push back. Bring that down here. Just bring your arm out here. Bring it out like that. So here I'm testing essentially the stability, bring it in, of the glenohumeral joint and then the scapulothoracic joint. Again, this may seem a little bit abstract, but we're going to work backwards because you're going to see the big picture here. Thumb up for me. Push up towards the ceiling. Good. Put this arm up like that. I push down, you push up towards the ceiling, okay? Don't let me move you. Push up. Oh, you're trying.
I'm trying.
Yeah, okay. So this is an indication that there's some scapulothoracic instability. How did I know that? I said there's probably some scapulothoracic instability. Because it's a trend, and we're going to talk about that when we get into the lecture part after we do this. Now, are you right-handed?
Yes.
Okay, that was a lucky guess, right-handed. I have like a 70% chance of me being right. But being a dental hygienist, I know I actually worked at a dental office years ago. There's a lot of work with your dominant and non-dominant hand. So what I do with the patient, and I'm going to treat this as if you're not here, as if this patient's in my office. So we have some instability. Push up for me. So definitely it's weak. Okay, so I'm going to go to the other side because I want to assess both sides. All right, push up towards the ceiling. Push up. Push back. Bring the arm out. Push into my hand. And inward. And thumb up for me. Push up. This is a supraspinatus. We're going to test the scapular stability on this side. I push down, you push up. Go ahead. Push up, push. And she's a lot stronger here. So I go over to my notes, and the checklist that you have, we'll go over how to use that. And demonstrate that, notate that her right side is inhibited. Now this is what then I do with the patient, because I want them to recognize what's going on. So we're going to retest. Push up. So I tell them this muscle right here that goes from to your ribs to the outside part of the shoulder blade isn't working. For instance, if I put my finger here on the outside part of the shoulder blade and stabilize it for you, watch what happens. I push down, you push up, go ahead. She's much stronger. But I take it away, you have no stability, push up, and that's shut off. Then I explain to them that this is important because we've all heard of muscles that have opposites, right? Like this is your bicep, and that's your tricep. They're opposite. When one flexes, one extends. Everyone can understand that, right? And so the serratus anterior muscle, which is this muscle here, is even more unique because it has two antagonistic pairs, two opposites. It has the trapezius muscle, and it has the rhomboid muscle, which is behind the shoulder blade. If you can just stand up for a moment, I just want to make sure everyone understands what I'm talking about. The rhomboid would be in here. This is the medial border of the scapula. The rhomboid is here. Let's have a seat. So what's happening is a lot of times the people who have neck pain and the people that have headaches have residual neck tightness, not because they have neck tightness. We know that they do have neck tightness, but is there an underlying cause? Definitely there's some instability. There's some motor inhibition of her serratus anterior, or more importantly, the stability of the scapular girdle. That's what EXSTORE is, which we'll get into after this. So I'm just going to do the upper scan, and what I'm going to do now is go and correct it. And this is a pointer plus, which many of you, if not all, are familiar with. We'll talk more about it probably during the questions. So your shoulder's going to move on its own. So then what I do, that's really good, is just do some passes along the mid-axillary line. When I do soft tissue, which we're going to learn, which we're going to go over a lot, you guys are going to be very proficient at soft tissue because when you go from 0 to 10, that's a huge increase. So you become exponentially better. So now you've done that, I reassess the patient. And what I do is I go to the same approach because I want to see the the amazement on the patient's face. I push down, you push up. Actually, we start up here. Push up, push up, push up. And bring that out for me. Push up in my hand. Push in. Thumb up, push up. Arm up, I push down, you push up. Go ahead. Push up. Push hard, hard, hard. Come on. And so you can see the dramatic difference. And the patient will feel like it's effortless now. Go ahead, push up. What does that feel like?
Yeah, it doesn't, yeah, I'm not struggling against you like I was before.
Good. All right, lie on this side for me. So I've made a mechanical change right there. And so this is not the end of the visit. Now I want to go after the soft tissue. Because what happens when we have motor inhibition, and motor inhibition can't stabilize the scapular girdle, motor inhibition plus loss of stability of a scapular or a skeletal girdle equals maladaptations of the soft tissue. Maladaptation means trigger points, means tight bands, means nodules, means adhesions, all the things we're going to talk about. So I address those areas based on my palpation. What I'm going to address is the rhomboid here. And I'm going to use an inline technique for that. You're going to feel a little tap, okay, Sarah?
Okay.
Probably a movement or retraction of the scapula. So I'm on the rhomboid and I'm cleaning the area of the adhesions, cleaning that.
Okay.
You're welcome. Give Sarah a hand, everybody.